Thank you very much for that introduction, and thank you very much for the invitation to come and speak at this conference. I found it, the 3 days, really inspiring. It's been wonderful to be actually at the conference listening to speakers, but it's also been lovely to speak informally to a lot of people from around the world. So thank you again, and I commend the Basque Country and the government on undertaking this wonderful conference. It's interesting being here as a speaker from Australia. We haven't really featured much in any of the discussion, and probably in a positive way as well. Australia has not been affected as significantly, obviously, as Europe and the United States as a result of the financial crisis. We've weathered the storm pretty well, and because of a lot of policies in regards to what the government undertook. What I hear here in Europe in particular, especially with the problems with youth unemployment and significant problems with youth unemployment, that the financial crisis was really like a tsunami that hit many countries. What we are seeing in Australia is death by 1,000 cuts instead. So rather than a tsunami effect, we are being affected by the economy downturn in small ways, but on a consistent basis. So I think the next 2 or 3 years will be very interesting. Firstly, I have to apologise for my voice. I've contracted a bit of a cold, so if it stops working during the presentation, I'm calling on my Australian colleague to come and finish it for me. Australia has a very well-known VET system, but as part of the presentation today, I'll talk about some of the policies that the government is implementing that I fear is going to be very detrimental to what is a world-renowned system. I have a very ambitious title here, Fostering Applied Research and Innovation through Industry Partnerships in Australia. What I'm going to try and do today in this presentation is link the themes of innovation, how it manifests in TVET and how TVET assists the innovation process. Secondly, look at applied research in TVET, and then I'm going to try and bring them all together, applied research, innovation and industry partnerships. And I'm going to use 2 case studies from my institute as examples. Both are from the health sciences area, and I think that you will hopefully find them an interesting example of how it can all come together. Firstly, just a little bit about my institution. I'm the Chief Executive of Holmesglen. It's a very large institution. It's a government-owned institution known as a TAFE provider. It's autonomous. We have our own board of directors. We invest, we're able to invest money ourselves. We have partnerships in Qatar and China, Mongolia, Malaysia and India. We've had long-standing relationships and history of work in the Middle East. We deliver over 600 VET courses, and we have 25 bachelor programs that we deliver and 1 master's program. And as you can see from the slide, we have significant numbers of enrolments at the Institute and significant numbers of overseas students as well there. The majority of our international students come from China, and India is the 2nd largest provider of students. The VET system in Australia is a bit of a mixed bag. We've seemed to have change and more change, and it really is a matter of the good, the bad and the ugly. I know there's a lot of people in the audience here today who have seen the good, and it is a very good system, and parts of it are still going will be maintained as a good system. But it has, we are undergoing significant change. Together with higher education in Australia, there's change in policy. We now have demand-driven funding for both VET programs and providers and for higher education. And what that means is that the students dictate where they go, and the government pays for the choices that the students make. The problem with that, I mean, it's good on one level that students are able to make a choice about where they go. The problem with it is that there is not much link, or there isn't any link at the moment, between skill shortages and the supply of programs. So a lot of the funding that is going towards both higher education and VET in Australia is following students and student choice. For a provider like myself, for ours at Holmesglen, there's no differentiation in funding for running a public provider such as Holmesglen. So there are now private providers that get the same amount of money for training that we get. It's on a competitive model. So we compete with 2,000 private providers in Australia for the same bucket of money. So in a sense, the government is not required to sustain our organisation. It's up to us to be competitive in this environment to ensure that we get students into our organisation. We are also working towards, or the government is working towards, a user pays model. Currently, the relationship or the split between government funding and student funding is 80 to 20%. And we are moving towards a 60-40 split. And our current Minister for Education is wanting Australian higher education and vocational education to look more like the American model than any other model. So I don't know whether my or our American colleagues or what they would say about that. What is really disappointing for me and for Australians at the moment is that there is an unclear vision for TVET in Australia, apart from apprenticeships and the support they provide. So just very quickly, the key features of our system and why it has been well respected around the world is that it's a national curriculum. We have national training packages, they're a key feature. They are curriculum-based, and so every student around in Australia who is undertaking a VET qualification will be doing the same qualification essentially. There's choice obviously within the qualifications, but the same qualification. They are industry endorsed and industry accredited. They're competency based as well. And as you can just see from a couple of dot points, we have a federated model in Australia, but there's 8 different jurisdictions, so there's differences in funding across the country. I suppose one of the things that really came to me in preparing for this presentation today is that, unfortunately, there's no real mention in any research and development or innovation policy in regards to VET and VET's place in it. And I'll elaborate that a little bit further. But just quickly, a snapshot. As I said, there's over 2,000 training organisations delivering public funded vocational education and training in Australia. My organisation is one of the 61 TAFE institutes, so they're publicly owned. Then there's community providers and then private providers. So as I said, we all compete for the same bucket of money for provision of training. Just under 2 million students enrolled in the VET system, and as you can see, there's a breakdown of where they are, whether they're in TAFE or private providers. So what is innovation? So the first theme that I want to talk about. TVET's role in innovation is seen as providing the skilled workers to be innovative through innovative teaching and learning of skills and knowledge and the application of those skills and knowledge. It equips workers with the skills needed to implement the innovation ultimately sourced from research. There is also innovation in TVET practice, such as in pedagogy, systems and products. However, there is a tenuous policy and government support and position ascribed to TVET in the national innovation system. Australia produces an innovation system report each year, which sets targets, reports on funding and the dollars spent. And whilst it states that innovation active businesses are acquired in the vet sector, there is no mention of vet in the targets, only universities. The Australian investment in science, research and innovation was about $8.4 billion in 2010 and 11, and a lot of that goes to university for pure research, and the applied research is essentially done in businesses. So, innovation in the TVET system, what conclusions have we? So we have a position where it is recognised that the sector plays a role in innovation, but it is not supported by policy or funding. In 2009, an OECD SERI study of innovation in Australian vet system found that there were 3 key innovations. And this is, I'm talking now about the innovations of the vet system itself, so the products and services. And those 3 key innovations were training packages, because of the nature of them, nationally accredited, industry informed, Australian technical colleges, which was a form of upper secondary schooling that delivered vocational programs in schools themselves, and a flexible learning advisory group. Now, 5 years is a long time. I think 5 years ago we didn't have iPhones, and 5 years is a long time in TVET too. We still have our training packages. The Australian technical colleges have gone. The flexible learning advisory group has gone. But perhaps it tells us more about innovation as a snapshot in time, and that to the system, business or process, that they need to continually evolve to be innovative rather than to be static in an innovative sense. What the OECD SERI study concluded was that organisations need to develop and support innovation, and I think it's really important for us as vet providers to take on board these conclusions. Firstly, we need to have drivers of change within our organisation. We need to have facilitators of innovation within our organisation. We need to know and recognise where the barriers are, and we need to ensure that we evaluate our work and actually learn from it. The second theme I want to talk about now is applied research. According to the Australian Innovation System Report, applied research is a growing component of business expenditure on research and development in Australia. However, again, there is no link to the TVET sector. I have a definition there of applied research taken from the OECD Frascati manual, and also have a definition of a basic research and the difference between them. But when we look at applied research within our organisations, we're talking about it's the original investigation in order to acquire new knowledge, but it's directed primarily towards specific practical aim or objective. How do we foster applied research? For TVET providers to assist industry innovation, we firstly need to look at how we support and foster applied research in our own organisation. We have embarked on a strategy to develop and enhance scholarly practice at the Institute. Teachers need to be the champions of innovation, and we need to be able to support them to develop their skills and knowledge, to integrate project-based learning, problem-based learning, evidence-based learning across all areas. And I think it's been mentioned a few times here at the conference, and in particular from the Deputy Minister, in regards to the importance of teachers in the innovation process. TVET cannot be a real player in the vet system unless we are innovative organisations ourselves, and in order to do that, we need to have innovative teachers. What we have done at the organisation, as I said, have embarked on a scholarly practice model. And we have adopted a model called the Boyer model, and I'll show you that in the next slide. And what the Boyer model is, Ernest Boyer was an American academic who looked at the 4 elements of scholarship, and they are discovery, integration, application and teaching. And the reason why we adopted this particular model of scholarly practice was we thought that it was a model that suited an organisation such as ourselves. What we have also done is develop scholarship policy and guidelines, and we implement them across the organisation. All teachers are required to meet certain guidelines, or the scholarship guidelines, and so we have set a framework that allocates points to scholarly practice that students undertake, whether they go to conferences, they do work back in industry, they write papers, they present at conferences, or they attend conferences, or they maintain their industry knowledge. All that work that they undertake is captured as part of their professional development program, and its teachers are required to maintain their scholarly practice each year by a certain number of points. It's working very, very well. It's been adopted by the teachers, and we are starting to see the fruits of that fostering of scholarly practice. This is just a slide to let you elaborate on Boyer's model. As I said, there's 4 types of scholarship that he identified. That's the scholarship of discovery, integration, application and teaching. And he then goes on to look at the purpose of those and then the measure of performance. And as I said earlier, the reason why we like this, and I think it's a really good model for vet organisations, is because it looks at the application of research, but it also then embeds it into teaching. And what we want to see, and what I want to see at my organisation, is innovation in teaching and scholarly practice in teaching, not just in pure research. So, TVET and industry. We know the links of TVET in industry. TVET has a long history with industry. We have in Australia curriculum development and accreditation through industry. We also have an apprenticeship model that is based in industry. We have a competency-based training model, project-based training model, and you've heard lots of examples of those about how we link with industry. I suppose the real issue for us, my organisation, is how we put our hand on heart and say that we really do this well with industry, because I think for a lot of organisations, especially vet organisations, I see is that it's, yes, we are linked with industry, but there's actually no real sense of how they work well with industry. I think the session that we heard on the first day with our American colleagues was very interesting, where it linked the community college work with the Manufacturing Institute and with real work. And I think the issue for all of us is how we endeavour to grow that capacity with industry. So how do all of this come together? Firstly, I think it comes together at a policy level, which is unfortunately not the case in Australia. Second, it can come together at a provider level, which I will briefly detail in 2 case studies where the TVET, the industry, the applied research and the innovation all come together. The first case study is one from our organisation. It's called the Victorian Simulation Alliance, and it's a collaboration between industry, government, providers, both vet providers and higher education providers, and it has practitioners. It's been very successful in sourcing funding for applied research into nursing clinical practice. And it's been a wonderful example of how as the industry, the practitioners and the organisation can come together to work on innovative practices. What this particular group is looking at is simulation, so nursing simulation. So what they're doing in sourcing applied research funding is to look at how, from a teaching perspective, we can enhance and innovate our teaching for simulation at the provider level, at the practitioner level and at the industry level, how they can implement then that innovative practice. The second case study is the establishment of a private hospital on the campus of Holmesglen. This is a major event for the organisation. It's a collaboration between a public provider, such as Holmesglen, and a very large health provider, HealthScope. It's an international provider. And what is happening is that the partnership is that HealthScope is establishing a 300-bed private hospital on the campus of Holmesglen, on one of our campuses in Melbourne. However, central to the agreement and the partnership with this health provider is an educational agreement. So everything stems from the educational agreement with this provider. And at the basis and at the core of the education agreement is a joint funding of a clinical chair for nursing. And what the clinical chair will do is undertake applied research into nursing clinical practice in conjunction with the institute and the hospital. So the campus where this hospital is being built is a health sciences campus. We are trying to develop it as a centre of excellence. And so what we are seeing now with the establishment of the hospital there to work in conjunction with our vet delivery of nursing courses, together with our higher education delivery of nursing programs, and the collaboration that we will work together to innovate, in particular for simulation and for nursing practice. However, in looking at case studies of innovation and applied research, I have to come to the conclusion is that in Australia, it tends to be local, ad hoc, disconnected to policy and funding, and it's not systemic. But it does not need to be. I think the Basque government has the opportunity to embed the key elements of fostering innovation and, in fact, has commenced down that path, in particular with some of the work that they are undertaking here. Gavin Moody is an Australian academic, a key academic on vet policy, and he suggests 6 steps to stimulate innovation in TVET. The first one is to emphasise innovation and not to get caught up in pure research, because a lot of the time vet organisations like myself that undertake higher education delivery, everyone believes that you then have to undertake pure research. You don't. And I think we need to look at that link between innovation and applied research. He also says to develop a distinctive role in the national innovation system. Again, act locally, learn globally. Partnerships are really important, networks are important, and act in the long term. Richard Curtin, who also looks at the issue from a policy and funding perspective, about access to government research and developmental funding, and to be part of the policy framework. My recommendation, and it's one that I will work hard on back in Australia, is to ensure that VET and TVET is in part of the policy framework in regards to innovation. That as a country we need to invest in research and development, and as part of that we have to involve not only higher education, not only universities, but also TVET providers, and that you fund applied research projects. And I think more importantly is that once you have success, that we start to mark the success of what we can do and the link between the work, the valuable work that we do as TVET providers in skilling the workforce of tomorrow, and also the work that we do in applied research and in fostering applied research capacity in both our own organisations and out at industry. Thank you very much.